I'm Rose Cipriano, and this is my son, Salvatore Cipriano, who goes by Sal. We come from Detroit area, Farmington Hills. So Salvatore was in a walker, and he had a feeding tube, and he was having a hard time eating things, and he had a lot of like a paralyzation on his left side also. Salvatore was doing physical therapy every day for probably 2 or 3 months, Monday through Friday, and still was having issues with trying to walk. He started having more seizures, and nothing was coming together, and we couldn't figure out what. We are both athletes, so we couldn't figure out what to do next to get him to be more independent and to be able to get up. He wants to play baseball again. He would like to possibly golf again. And so all these questions going through my mind and our mind, talking to doctors, therapists, what can you do to get him to be able to walk again and to get back to a more independent life? We started seeing a chiropractor that we've seen for about 6 years before our tragedy, and he tested us and said, why don't you go to Canada, to Windsor, and see Dr. Lemo? He could possibly help you with some of the things we're trying to heal with. So we came to see Dr. Lemo, and he started him out, testing him and getting him on exercises. Within a week, he was able to walk without a walker. So Dr. Lemo, by testing Salvatore and then saying things that could come together to get him to become more independent as a walker, yeah, it's very overwhelming, and it's not something we heard from anybody. Everything is connected, so I started learning more about that. Yeah, let's see what you say. He was drooling on his left side. He essentially had paralyzation on his left side. So he was drooling. He couldn't use his left arm very well and his left leg. As soon as probably within a month or two, that stopped. Of doing these exercises that Dr. Lemo gave us to do every day. And
Sorry, he's moving his arm now.
yeah, he's,
Dude, you're good on your left arm?
oh, everything. He walks by himself. That's exactly what Dr. Lemo helped with, yes. To become more independent, and that then Salvatore and I, he could do a lot more himself. Because we went to 24/7 care at home. We had to leave when he got out of the hospital, he went to a lot of rehab places, and then came home, because I said enough of that, come home, and then we were having 24-hour, 7 days a week home care. We had to watch out for seizures and what types of food was around. I mean, everything had to be very planned, very planned. When he became more independent with walking, then we could start working on other things because he could get out of the house. This was a thing. He was very confined to the home.
And today?
What do I say? Not as planned. He's a lot more flexible, a lot more independent. He's become more cognitive after seeing Dr. Lemo also. Salvatore's nonverbal, and fortunately, he had a phone before our accident happened, so this has become avenue of communication for him, huge. He will use the iPod to communicate. I feel very blessed that we found Dr. Lemo and that we were able to do the exercise, be able to do the work we needed to do. But he was our, how to put this, he was the person that guided us to get to where would help my son become more independent.
Sal, what do you think? What's the biggest thing, most important benefit to you that Dr. Lemo treating you has brought you?